Hi, friends. Today we are doing lip debulking surgery, upper and lower lip debulking together. So most of the time, patient comes with a complaint of very thick looking lip. Uh, Sometimes there is localized hemangioma or lymphangioma or some pathology which gives appearance of abnormally thicker lip vermilion. So in such cases we advise lip reduction surgery. So basically this surgery is a office based procedure. It can be done under local anesthesia. This surgery requires approximately 1 to 1.5 hours for lip, each lip. There is not much of investigation is required for this procedure. It is just basic blood investigation, and surgery can be done under local anesthesia. In this surgery we do the proper marking which area exactly requires reduction, and after proper marking we do full thickness debulking along with some part of the muscles, and suturing is done in 2 layers. Usually sutures are dissolvable sutures, so no need to remove them. Post surgery there is swelling, so most of the swelling will settle down in 5 to 7 days time. So we can say downtime is around 5 to 7 days, and after 7 days lip swelling reasonably disappears, and it may require little more settlement which may take around 1 to 3 months time. So patient can resume office in 5 to 7 days time. Post surgery patient requires a course of antibiotic and painkiller for 5 days. So this is relatively safe surgery, and it can be done as a office based procedure.